Hi, my name's Debbie Childerhose, and I'm a physical therapist working at Women's College Hospital. I work in the field of cardiovascular disease. I love being a physiotherapist. I love working with women, trying to understand the disease process and how to live with it. I work with an incredible interprofessional team, and we come together to help work with these women and their risk factors for heart disease. The objectives of this module are as follows: to review the rates of cardiovascular disease in Canada, describe the role of physical therapists in cardiovascular disease, identify the health benefits of exercise in cardiovascular disease, and look at risk factors for cardiovascular disease. Cardiovascular disease is the #1 cause of death for men and women in Canada and worldwide. In Canada, CVD accounts for more than 4,000 deaths per year, more than all forms of cancer combined. Every 7 minutes, a Canadian dies of cardiovascular disease. If you think about that, non-communicable diseases, such as cardiovascular disease, is increasing by 17% worldwide, whereas infectious diseases are declining by 3%. Ischemic heart disease is another word for cardiovascular disease. When the heart muscle is damaged or works inefficiently because of a reduced or absent blood supply. This process can result from atherosclerosis, which can lead to chest pain, otherwise known as angina pectoris, which could lead to a heart attack or a myocardial infarction and results in ischemic heart disease. These diagrams illustrate the process of atherosclerosis. The top left is a picture of a healthy artery, nice and smooth muscle and clear. The top right one shows a tear in the artery wall and some buildup. The bottom left looks at fatty material deposited on the vessel wall, and look at how narrow that vessel is becoming. And then the bottom right picture shows the narrow artery becomes blocked by a blood clot, and therefore everything leading away from that artery can be damaged with not getting any oxygen. This is a common process thought in the development of heart disease. This is a diagram of the heart and a focused picture of blocked blood flow. So the heart receives its own supply of blood from coronary arteries. These arteries branch off the aorta near where the aorta and the left ventricle meet. These arteries and their branches supply all the parts of the heart muscle with blood. There's a left side branch that branches into the circumflex artery and the left anterior descending, supplying the left side of the atrium, the side, the back, and the front of the left ventricle. Also, there's a right side branches that help to feed the supply of the right atrium and right ventricle. And the circumflex artery supplies the bottom of the left ventricle and back of the septum. And also in this diagram, you can see smaller, what we call collateral circulation, very tiny blood vessels that helps in blood supply to the heart. You might be asking yourself, what is the role of a physical therapist in cardiovascular disease? Many people think physiotherapists work with only musculoskeletal injuries or orthopedic injuries or sports injuries. But if you think about it, physiotherapists are exercise experts, and they help the injured player, injured person, mother, grandfather return to their full role and learn about their risk factors for cardiovascular disease, and their education is huge focus is on exercise. So you might meet a physiotherapist in the hospital at bedside after someone has suffered from a heart attack or post-heart surgery. You might meet them in home care, coming to visit after someone's been discharged home to help getting mobile, and then eventually into a community-based cardiac rehab. Especially aerobic and strength training are two key factors that physiotherapists help to teach the heart patient. Again, physios are experts in prescribing these as a part of a structured, safe, and effective program. Physios help to guide patients through exercise prescriptions, just like medicine prescriptions, to help a patient return to activities of daily living, returning to work, and full community participation. Physical inactivity has been finally focused as a risk factor for most chronic diseases. We think of the changes of living and working pattern have led to a less physically active lifestyle, and there's less physical labor. The World Health Organization attributes about 15% of cancers, diabetes, and heart disease to physical inactivity alone. Physical activity is a lifesaver. It cuts the risk of cardiovascular disease almost in half, helps to control those major risk factors I mentioned, such as blood pressure, high cholesterol, obesity, and type 2 diabetes. I can't think of one health guideline that doesn't include a component of physical activity for the treatment of their disease. Here is a list of cardiovascular risk factors. Some are non-modifiable, something we can't change. We can't change our family history. We can't change our age. Menopause and ethnicity are also non-modifiable. But look at the longer list of modifiable risk factors. Smoking, having high cholesterol, hypertension, diabetes, sedentary, overweight, stress and depression are risk factors that we can control. The modifiable risk factors account for more than 90% of the risk of an acute heart attack, and we can do something about it. These are the physical activity guidelines. We should accumulate 150 minutes of moderate to vigorous physical activity over a week. Full body activities. If everyone walked briskly at 3 to 4 miles per hour or 5 to 6.5 kilometers per hour on most days of the week, about 30% of death from cardiovascular disease would be prevented. For resistance training, guidelines show we should be doing that 2 to 3 times a week, preferably every other day in the week. And resistance training not only can help musculoskeletal health, but with respect to cardiovascular disease, it helps to decrease excess blood sugar levels, improve insulin sensitivity, works on our balance, improves our posture, and really results in increasing our function, especially in the elderly, looking at grip strength and getting out of a chair. There are many benefits of increasing your cardiovascular fitness. Increasing your fitness is equal to losing weight, losing 7 centimeters around your waist, or helping decrease your blood pressure by 5 points. Also, increasing your fitness helps to reduce the negative cholesterol. If you reduced your fasting glucose by 1, it helps to increase your profile. Also increasing HDL, which is a good cholesterol. And we know increasing your fitness helps your mental health, helps with coping with depression and anxiety. Now they're looking at sedentary lifestyle or sitting as the new smoking. We know how evil smoking is to all the parts of our body, but now looking at exercise guidelines and guidelines in the treatment of most chronic diseases, we're seeing that physical inactivity is a huge risk factor and it needs to be addressed. In conclusion, there's an important role for exercise in the treatment for cardiovascular disease. Seeking a physiotherapist in your community along the healthcare continuum is a way to receive valuable education and appropriate and tailored exercise programs for heart health. Thank you for tuning in to this module. If you would like to contact me via email or follow me on Twitter, the links are below. Thank you very much.